Welcome to the Living Life Well show, the intersection of God's Word, today's science, and healthy living with common sense application, all based on the truth of the Word of God. I'm your host, Dr. Jon Skelton. Now let's get straight to the truth. Welcome to the Living Life Well show. If you found this episode, you are likely looking for answers that your doctor hasn't given you. You have been told that prediabetes or type 2 diabetes is a progressive disease, that it only gets worse, and that your only option is to manage it with medications. But what if the standard diabetic diet, the one telling you to eat frequent small meals, is actually making you sicker? Today, we are doing something different. I've compiled some of the most important lessons from our 8-week Metabolic Reset into one masterclass episode. We're going to destroy the myths surrounding insulin resistance and look at the real biology that is preventing you from losing weight. We will cover why intermittent fasting is the most powerful tool to lower A1C, why hidden cortisol spikes from stress are keeping your blood sugar high even when you don't eat, and the specific foods to avoid with diabetes that are marketed as healthy but are actually fueling the fire. So if your goal is to finally put in remission or reverse metabolic syndrome, prediabetes, or type 2 diabetes, put down the distractions and listen closely. We're about to hand you the keys to fix your metabolism. Now, let's define the landscape of what we're talking about. So let's get clear on what we're actually fighting. There's a lot of confusion about this. So there's a lot of confusion between the types of diabetes. So let's use a simple analogy. The lock and the key. Insulin is the key. It unlocks your cells to let energy or sugar in. Okay? Type 1 diabetes, the body has lost the keys. The pancreas stops making insulin. This is an autoimmune disease. Type 2 diabetes, the body has plenty of keys, often too many keys, but the lock is jammed. There's insulin resistance. There's so much sugar floating around that it has corroded the lock so the key can't work. The cells refuse to open. Prediabetes is the warning light. The lock is sticky, if you will. This course is designed primarily to unjam the lock. We are fixing the resistance. So the issue isn't just sugar, it is insulin and sugar, this relationship. But why are the insulin and sugar that are present not able to work properly? Well, this gets into root cause. So if you go to a standard doctor, they might just say lose weight. But the real answer is much more complex. It is rarely just about eating too much sugar. The root causes are typically chronic inflammation. Your body is on fire at a cellular level. Hyperinsulinemia, you have had high insulin levels for years before your blood sugar ever showed up high on a test. The nervous system. This is the missing link. You cannot heal a body that is stuck in fight or flight mode. Chronic stress raises blood sugar just as fast as a candy bar. And then using wrong or insufficient lab levels. Just using hemoglobin A1C is not enough. You need a thorough battery of tests that look not just at blood sugar, but insulin secretion, inflammation, and your endocrine system as a whole. So, now, let's talk about cleaning the fuel supply. To lower those numbers, we must stop fueling the fire. The first thing we have to do is we have to eliminate added sugar and artificial sweeteners. Notice, I did not say that we have to eliminate all sugar. I said added sugar and artificial sweeteners. It's obvious that sugar spikes blood glucose, but why artificial sweeteners? The trap, artificial sweeteners like aspartame and sucralose can still trigger an insulin response because your brain tastes sweetness. and prepares for sugar that never arrives. It's a trick in our brain. They also can disrupt gut health, which drives inflammation. The inflammation has to go for the blood sugars to start to come down. Okay. So, number one, eliminate sugar. Number two, to be able to do that, we have to learn to read labels. The front of the box is marketing, the back is the truth. Ignore claims like low fat, heart healthy, and natural. There are often marketing terms used to hide sugar. If any of these labels are on there, 9 times out of 10, it is a garbage dump of shelf stabilizing, flavor enhancing, addiction creating junk. So, the rule of thumb, look at the list of ingredients first. If a product has a long list of ingredients that you can't pronounce, it is likely not food. It is a chemical mixture designed to be addictive. But we need to really look at why people may have elevated blood sugars in the morning. So many people wake up with high blood sugar even if they didn't eat overnight. This is often the dawn phenomenon or a reaction to poor sleep. Sleep aids can lead to this as they rob you of deep sleep. They allow you to fall asleep and sometimes even stay asleep, but they never provide true restorative, detoxifying deep sleep or rest. The same with sleep apnea. There is no true recovery because deep sleep is so little and infrequent, it triggers a stress response and specifically cardiovascular inflammation. This stress response creates a fight or flight situation when oxygen levels drop, resulting in increased heart rate, blood pressure, in addition to the fight or flight hormones like epinephrine and cortisol. When we find that blood sugars in the morning are higher than blood sugars prior to bed, this is an indicator that we are not getting restful sleep. And to be able to reduce inflammation and stay off diabetes meds, this is a critical piece. Okay, now regulating the system. When you are stressed, your body dumps glucose into your blood to fight or flee. You can eat perfectly and still have high blood sugar if you're chronically stressed. We must address the hidden sugars, grains. The misconception is that we are taught that whole grains are heart healthy, and they are when there is minimal inflammation and insulin resistance, as well as they are truly the whole grain. But for an insulin resistant body, a slice of whole wheat bread breaks down into glucose very quickly. Not quite as fast as straight sugar, but quickly nonetheless. So, carbohydrates are chains of sugars. When you eat bread, pasta, rice, or corn, your body unchains them and floods your body with glucose. Your insulin spikes and fat burning stops. This is made worse by our current processing techniques. True whole grain, which is actually somewhat difficult to find by itself, actually, has added protection with bran and germ. These two parts of the wheat berry or the wheat kernel are what really provide the protein, the vitamins, the minerals, and the fiber. The fiber and the protein help to keep us satiated or keep us full. Even here in the US, for something to be called whole grain, only 51% of the grains in the product need to be the whole wheat berry. This means nearly half will just be endosperm or carbs. So, yes, whole grains, when truly 100% with no added sugars, you still need to read the labels, can be very beneficial for health. And once insulin resistance is down, I do recommend these 100% whole wheat grains. And we will discuss this as we add grains back in. This is what you think of when you think of resistance training, weight training, right? Well, we aren't trying to change you into a bodybuilder, but we are trying to increase your metabolic reserves. Strength matters. Muscle is your biggest metabolic currency. It's the biggest glucose sink in your body. The more active muscle tissue you have, the more glucose you burn at rest, even while sleeping. And listen, you don't need a gym. You don't need weights. Your body is the machine. Most people have the resistance workouts all wrong. The meatheads per se look like the guy I described earlier. Well, that person is missing out on really activating the biggest muscles in their body, the core, the legs, and the buttocks. These are where the biggest benefits from resistance training comes. Working the core and lower body will activate your ability to really burn through glucose and create sensitivity to your body's own insulin production due to the increased demand for glucose by the muscles. So, with that being said, we need to take the mantra leg days make for more days. Okay. Leg days make for more days. All right. So, what do we do? Well, we need to focus on what I call the metabolic 3 routine. Okay. Now, now we need to look at your logs, reviewing the data. Look at your post sleep numbers. Are they consistently higher than your pre sleep numbers? If yes, your body is stressed while you sleep. Sleep apnea, stopping breathing during sleeps, is massive in type 2 diabetes. The cycle is this: you stop breathing, oxygen drops, adrenaline and cortisol spike to wake you up, your heart rate increases, your respiratory rate and blood pressure all increase, adrenaline dumps sugar into your bloodstream for energy, and then you wake up with high blood sugar. You may not even really realize you're waking, but you are. If you snore loudly, wake up gasping, or feel tired despite sleeping 8 hours, you need to be tested. So, when we talk about sleep apnea, really treating sleep apnea can many times lower the A1C as much as a medication. So, other aspects of sleep. Sometimes it's not sleep apnea, but we wait to urinate or because of abdominal pain or a mind that is going. So, a few things to do to improve sleep hygiene. Number one, make it cold. Shoot for 66 degrees. Make it dark. Blackout drapes or sleeping mask. Make it quiet. Earplugs if needed. Stop all liquids 2 hours before bed and stop all food intake 3 hours before bed. All right. So, next topic. This is one that I am very, very excited about. So, we're going to talk about digestive rest. We discussed the last time ending that eating window 3 hours before bed. That is so that we can truly rest and digest as well as set you up for success this week. We aren't doing anything extreme here. I just want you to focus on a 12-hour fasting window. This is the digestive reset. It's simple math. If you stop eating at 7 p.m. and you don't eat breakfast until 7 a.m., that's 12 hours. That's it. This is a 12-hour break, allows your insulin levels to begin to drop, and gives your body the time it needs to perform cellular repair or autophagy, otherwise known as taking out the trash, rather than constantly focusing on digestion. When you're constantly eating, your gut never rests, and the waste at a cellular level never gets cleaned up. This leads to inflammation. The 12-hour fast is the easiest way to improve metabolic flexibility without feeling deprived. Now, for those of you on medications, we need to pay close attention to the timing of meds as well as resultant blood sugars. For some of you, you may snack right up until bedtime because otherwise your sugar goes low. If that is the case, your medication dose either needs to be reduced or eliminated. Go back to lesson 2 and see some parameters there. As we move along in the course, we're going to increase this fasting window, and we will talk more extensively about the benefits of fasting at that time. But you need to start here, start now in that 12-hour window, and make sure you have the right authorization to proceed in that fasting 12-hour window. This week, we are stepping up the intensity on your nutrition, your fasting, and your movement. So let's move right into it. So the fructose elimination. First, we are refining your food choices further. We're going to eliminate high fructose fruits and vegetables. I know fruit is natural, but right now we're trying to lower your insulin baseline. Fruits with high sugar content can spike your blood sugar just like a candy bar if you're insulin resistant. The first thing we need to understand is that all fruits are not equal in sugar content, fiber content, or overall nutrient content for that fact. Some are low sugar, high fiber, high nutrient. Some are high sugar, low fiber, and lower high nutrient. We want to focus on getting in the low sugar, high fiber fruits and veggies with the other nutrients in either low or high quantities as a bonus. High sugar and low fiber need to go. So, how do we do this? Well, a good rule of thumb is to look at a fructose chart. I've supplied one in the downloads, and you will see it here while I go over this. So, there are two things we want to look at on this chart: fructose/sugar content per serving and serving size. So, you may ask yourself, why both? Why not just sugar? Well, because serving size can be very deceiving. For example, let's take blueberries. If you're looking at the chart, you look on the chart and they're at 7.4 grams of fructose. Anything above 6 should be avoided as a general rule. Now, let's look at pineapple. Its fructose content is 4 grams, nearly half of blueberries. Now, just thinking about these two, that seems crazy, right? Blueberries are never as sweet as pineapple. Well, here's where the serving size comes in. For blueberries to contain that 7.4 grams, their serving size is 1 cup. That is 8 ounces of blueberries. I don't think I've ever eaten 8 ounces of blueberries in one sitting in my life. Most containers of blueberries are sold by the cup or pint, 2 cups. Most of us would at most eat a half a cup at a time. So the most you are getting is 3.4 grams of fructose and all the blueberries you can stand. Let's face it, you probably are really going to eat a handful of blueberries, and that will translate to about 2 ounces or a quarter of a serving. If that is the case, the fructose you're getting is only 1.6 grams of fructose. Much, much lower than the 7.4 grams that are listed on this chart. Okay, so let's go back to pineapple. Remember, it was listed as 4 grams per serving, but a serving is 1 thin slice, or maybe at most 2 small chunks. I don't know when in my life I've been served pineapple and eaten that little. A large Hawaiian pizza probably has the equivalent of 3 servings, and if you eat 3 slices, that is probably about 1 serving or more of pineapple here. You've mastered the 12-hour digestive rest. Now we are pushing to 16 hours. This is often called the 16-8 method. You fast for 16 hours and eat within an 8-hour window. This is the sweet spot where your body really begins to tap into stored fat for fuel and ramps up autophagy, the cleaning out of the old damaged cells. The reason this is the ideal is because of the gut rest and insulin sensitization that can occur because of the prolonged overnight gut rest. The longer you can go from end of eating to going to bed, the more benefit you get. It's a mental challenge as much as a physical one, but the clarity you feel is worth it. Mental clarity starts around the 12-hour mark, and so many of you may not have experienced that much as yet, but you should over the next several weeks. You can do this routine for up to 5 days a week. The great thing is fasting is portable and dynamic. This routine also works great when traveling for work or even on vacation. Adjust and take advantage of the flexibility that this offers. And with that comes calming the mind. Now, an unusual but effective technique to help this is forced yawning. Yes, I said forced yawning. I know it is crazy sounding, but 3 or 4 forced yawns will shut off the sympathetic drive and help focus the mind. Just talking about this is making me yawn. It helps when going into a known stressful situation, and for those who have trouble shutting down the mind, to go to sleep. Just heard the roadmap. You now understand that your body isn't broken, the signal is just blocked. But knowing the science is only step 1. Applying it every single day, navigating life like the grocery store, and knowing exactly how to time your fasting window, that is step 2. If you are ready to stop guessing and start healing, I invite you to join our 8-week metabolic reset. It's the complete blueprint where we walk you through the protocols you just heard about step by step to help you eliminate medications, drop fat, and reclaim your energy. So, by listening to this episode, I am happy to provide two special opportunities. First one, a discount code for you for 15% off this metabolic reset. It's reverse DM now. If you're interested in finding out more about the course and possibly using the discount code, click the link below in the show notes or in the comments. The second thing is we're having a giveaway for one lucky person. You will get the metabolic reset for free, full access to everything. If you're interested, just click the link in the comments for more information as to how to be entered. And finally, a favor to ask. There are millions of people struggling with misinformation about their blood sugar. If this episode gave you a light bulb moment for your own health or made you think of a loved one, please rate, review, and share this podcast. By doing so, you help get this life-saving information to the people who need it most. So, thanks. And God bless. That's it for this episode of the Living Life Well Show. If you like what you've heard and want to learn more, or want to know how to put this into practice for yourself, go to livelifewellclinic.com. Until next time, this is Dr. Jon Skelton saying go out and live the truth so you can live life well. The preceding is for entertainment and educational purposes only. It is not meant to be used to prevent, diagnose, treat, or cure any condition. The information contained in this show does not substitute the need for a qualified medical professional, nor is it meant to provide medical advice or services. If you feel information presented in this show may apply to you, we recommend you seek out the help of a qualified medical professional who can evaluate and treat your specific concerns.